So our first speaker is Dr. Sarah Allen, who is going to speak to us about antibiotic use in equine practice, wounds and respiratory disorders. Sarah obtained a Bachelor of Veterinary Medicine from the Royal Veterinary College in 2006. After working in equine practice for 8 years, she returned to the RVC, firstly to complete an MSc and then a PhD in veterinary epidemiology. Her PhD developed an equine arm to the RVC's VetCompass program, and she subsequently used the anonymized clinical records to determine common disorders seen in equine practice and explore antimicrobial prescribing habits in the horse. Some of that work is what we're hearing about today. She was appointed lecturer in veterinary clinical epidemiology at the RVC in January 2023. And she would be too modest to tell us, but she's actually joining us from Australia this morning. So a round of applause from us, Sarah, for making the effort to be here. So really looking forward to your presentation, and over to you. Thank you.
So yeah, thank you so much, Katrina, for that introduction. Hopefully my slides have shared okay. So today I'm going to talk to you about some VMD funded work that we completed, I think it's a couple of years ago now, which looked at antibiotic use in the treatment of wounds and respiratory disorders in the horse. And so just like to also acknowledge my co-authors on this work, so Christine Verheyen, Dan O'Neill and Dave Broadbelt, who are also all at the RVC. So in terms of the background to this project, as everybody on this call is aware, antibiotic resistance is an increasing threat to animal and human health, with the 2015 O'Neill review estimating that by 2015 there'll be an estimated 10 million human deaths per year due to widespread antibiotic resistance. So we know that one of the main drivers for the development of resistant genes is inappropriate usage of antibiotics. Therefore, if we're wanting to preserve their efficacy, we need to make sure that we are using them appropriately. And that's particularly important when it comes to those that are classed as category B antibiotics, which are those deemed to be of highest priority, critical importance for human health, which when we are treating horses is most typically the third generation cephalosporins and nivocephalosporins, quinolones and the polymyxins. So if we look to monitor how antibiotics are used, we can potentially identify areas for improved stewardship. But doing that based on sales data alone is really difficult within the horse because often antibiotics are used off-label. And so that's where VetCompass comes in. So VetCompass is the RVC's veterinary companion animal surveillance system, and it collects de-identified electronic patient records from a network of practices across the UK. And then within those records, we can explore the prescription data to give you an idea as to how many horses are treated with antibiotics each year, with what classes of drug, and also kind of the reasons for antibiotic prescription. So the first piece of VMD funded work that we did looked at antibiotic use more widely. And so within the VetCompass data set, there were 64,322 equids that were attended by veterinary practices in 2018. And of those horses, just under 1 in 5 was prescribed an antibiotic within that 12-month period. And of those, roughly 1 in 10 received a category B antibiotic. I then read through the clinical records of around 4,500 courses of antibiotic prescription, determined as to what the most common indications were. And so about 40% were for skin disorders, with roughly 2/3 of those being wounds, and around 10% were for respiratory disorders. And then when we just kind of focus in on the courses that included a category B antibiotic, then skin disorders and respiratory disorders ranked second and third behind urogenital conditions. However, often for the urogenital conditions, usage is at a local level rather than to the systemic level. So the purpose of the follow-up project was to look at antibiotic use within the treatment of wounds and respiratory disorders in horses in more detail. So again, we used data collected from the 39 practices that were included in the first part of the work, and then we randomly selected horses that were treated for wounds or respiratory disorders within 2018. So these were identified using electronic keyword searches, and then I read through the records to pull extra information about kind of the clinical presentation of these animals and also kind of the outcomes. And then when it came to reporting on how common antibiotic use was, we used counts and percentages and looked at overall usage, and then for the category Bs collectively, and then for the individual antibiotic classes. And then we also report the percentage of prescriptions that were formed by bacteriological culture. So of the 600 horses that were randomly selected as having sustained a wound in 2018, there were a few horses that sustained multiple injuries during the 12-month period. So those horses contributed 633 wound events in total. So of those events, 490 were prescribed a systemic antibiotic, with 3.1% of those prescriptions supported by bacteriological culture. So where antibiotics were prescribed, a category B product was used in 44.9% of events. And encouragingly, we then see that a greater percentage of these prescriptions were again supported by bacteriological culture, with roughly a third. Where the category B antimicrobials were used, they were often used as the first line treatment. So they were the first choice antibiotic in 82.5% of events where they were used. So on this next slide, I report the percentage use of each of the different antibiotic classes, and we can see that most commonly we have the potentiated sulfonamides, which potentially relates to kind of their ease of administration, followed by the tetracyclines and the nitropenicillins. And then the category B antimicrobials are in the darker teal colour with the purple boxes around their labels, and so they kind of were the fifth and sixth ranking most common antibiotic class. When it came to looking at horses with respiratory disorders, it was appropriate for us to separate out the non-race horses from the racehorse population, just due to differences in the way that they are managed and their kind of reports and their conditions are reported. So within the 600 non-race horses that had a respiratory disorder in 2018, they contributed a total of 614 respiratory events. Of these events, 223 received systemic antibiotics, which is equivalent of 36.3%, and then 11.2% of these were supported by bacteriological culture. Where antibiotics were prescribed, 7.6% included a category B antibiotic. And again, we see a kind of a greater proportion of these are then supported by bacteriological culture, with these running 29.4% of events. But again, we do see that where these are used, they are commonly used as a first-line therapy, so in 82.4% of cases for these respiratory disorders. When we look at the individual classes of antibiotics that were used in the management of respiratory disorders in non-race horses, we see a very similar pattern to what we saw with the wounds. So again, potentiated sulfonamide was the most commonly used class, followed by tetracyclines and then the natural penicillins. And then the category B products, so the cephalosporins and the quinolones, are then in those fifth and sixth ranking position. So within the racehorses, we identified or randomly selected 310 racehorses that were attended for respiratory events within 2018. These horses contributed 527 respiratory events, and the greater number of events per horse represents the fact that often racehorses will have their upper airways examined routinely. And from the records, it wasn't always possible to determine if this was due to a clinical problem or just as kind of regular management of that horse. So of these 527 respiratory events, 96 were prescribed systemic antibiotics, which equates to 18.2%, and then 17.7% of those were supported by bacteriological culture. Where antibiotics were prescribed, then there was a greater usage of category B antibiotics, with 34.4% of prescriptions including a category B antibiotic. Again, with kind of limited evidence that this was supported by bacteriological culture, with only evidence of this in 6 prescriptions. So when we move on by looking at the individual antibiotic classes, again, potentiated sulfonamide ranks as the most commonly used drug. However, we now see that the cephalosporins has shot up to be the second most common antibiotic class that was used. So this slide just summarises everything that I've shown you today. So in terms of the proportion of events that prescribe systemic antibiotics, then it's roughly 77% of wounds, 33% of respiratory events in non-race horses, 18% of respiratory events in the racehorse. We do see discrepancy between the different clinical presentations and then also the type of animal being treated in terms of what classes are then prescribed, with the greater use of the category B classes within the racehorse population. Encouragingly, when the category B products are used, we do see greater use of bacteriological culture to support that prescription. However, this is still only performed in less than kind of 1 in 3 events. And so the limitations of this work is that the incomplete recording of clinical details presented full assessment of product appropriateness and dosing. And this is also a convenient sample of practices which may kind of limit the generalizability of results to the wider equine population. That said, veterinary electronic patient records can be used to monitor antibiotic use and improve stewardship within the horse and other companion animal species. The empirical use of category B antibiotics remain commonplace, and further work is needed to understand the reasons for this. So that's a very quick run through of the 2 projects that the VMD have kindly funded for us, and then I'll answer any questions in the question gap later on.
Thank you very much, Sarah, and yeah, really fascinating insight that we don't have that sort of overview and information elsewhere. So thank you very much.